Our next guest is Quinn Burrell. She's an artist at Game Changer Chicago, which is a nonprofit at the University of Chicago that provides health and STEM interventions for youth on the south side of Chicago. She's going to talk to us today about the challenges of catering their message about COVID to this population that generally mistrusts the mainstream media. Quinn, thank you so much for being with us. We're delighted to have you and can't wait to hear your talk.
Thanks so much. Yeah, I just want to start out by thanking the whole conference team, Calliope and Jen and Sarah and Britt and everybody else. It's been really nice to work with everybody. The other presenters, like this morning's programming has been amazing. Jenny and Katie and Scott. I did want to do a quick plug for my cousin has made, my 11-year-old cousin has made a bunch of greeting cards with penguins on the front that I posted about in the Facebook page. And all the profits are going to penguin conservation. And even if you don't want to buy any, just like or comment on the Facebook post, I think she'd get a kick out of it. So, yeah, so I'm gonna try to remember how to share my screen. Okay. Everyone see that? Can someone give me a thumbs up in the chat? Great. All right. Okay. So scientific illustrators, we're usually covering topics with many years of consensus behind them, and we aren't often trying to convey information about a topic as it unfolds. Adjusting on the fly as information becomes obsolete or overly saturated. And this is an unfortunate necessity for any COVID-19 project, of course. So at the end of March, I proposed a project like this to my team at the University of Chicago. And a few weeks ago, we finally released our educational COVID-19 animation called One Day at a Time. This project was a learning experience for me, definitely. And I'm going to talk about what has worked, what has happened so far, and what I've learned. And all of this will be detailed in an article for the COVID edition of the GNSI journal. So why an informational video? COVID information is a crowded field right now with a lot of variable accuracy. There's also a bunch of different angles. We saw Jenny Fairman and the Johns Hopkins did a very, very granular, very technical presentation, which was amazing to see. We wanted to do a general informational video because we thought we could make it unique. To that end, in addition to the standard goals for a project about a new disease, such as increasing pro-social health behaviors among viewers and increasing knowledge of the disease, symptoms, and transmission, we also wanted to emphasize our own goals with this project, such as making it accessible to our target population of primarily Black and Brown youth. And we also wanted to emphasize mental health tips. So this is our project team. We also ran the script by our Youth Advisory Council, which is a group around a dozen high school students from Chicago who are all Black teenagers. And this is just a very quick breakdown of how I spent my time over the past few months. The lighter gray is where I was sort of working on something, but it wasn't the primary focus. Just to give you a general sense of how this all went down and really just how much time we spent on the script. So we started out with the intention to make an educational animation directed specifically at young people, especially Black and Brown youth on the south side of Chicago, which is where we focus most of our work as an organization. The reason we chose to focus on this population is twofold. First is the aggressive and condescending rhetoric that we saw aimed at young people. The article on the left of the screen is from Cleveland.com, is my personal favorite headline of these, just very incredibly condescending. Like, I don't know how any young person could have a good takeaway from this article. And then second is that many Black people are disconnected from mainstream news sources that don't represent them well. The Tribes article about a big house party on the west side of Chicago got a lot of attention, and highlighted this issue very well, and that's the image on the right. We spent a lot of time going over the script and making changes, and we ended up making a small change later when I was in the process of animating to acknowledge protesting, since the Black Lives Matter protests had taken center stage at that point. Because the language in the script was so vital to our project, the concept art phase ended up being incredibly important. All told, there were about 6 pairs of eyes on the script at different times, many of the people from our project team, and I was often waiting for feedback. We also didn't get our grant approved until the end of April, so I used a lot of that waiting to work out details ahead of the actual animation. These included the storyboard, color palettes, and background and character design. So this is all stuff that I just sort of worked out while we were still waiting for script edits and approval. So this should be a GIF. I'm concerned that it's not playing, but I guess that's just not working today. So this is a storyboard I came up with. There's some changes that were made subsequently, but it got the point across and also helped me figure out where the animation was going to be too time intensive and I needed to cut back on some of the animation work. I also delegated parts of this, some of these overhead scenes to another animator, so this helped us work together on different pieces. Very disappointed this isn't playing. So the color palette, because we were going for an empathetic and friendly message, I really wanted to emphasize comfortable colors in the palette. Here are some images I collected as reference. I picked the New Yorker cover because it was a good example of tying cool and warm color to emotions. So a lot of peach and pale purple and very like friendly, comfortable, comforting colors. And then here are some of the backgrounds created by myself and my coworker. Making and refining a palette was great because it helped us pick colors quickly when starting a new background and to string the scenes together in a cohesive way. Here's some inspirational images I used for creating our characters. I know that I have a tendency to make my characters overly realistic as a scientific illustrator, and I really wanted to do something simple that would animate quickly and also have like a nice texture. And here's our finished character sheet. Another benefit of the pre-production period was that I was able to look at all the spaces in the storyboard where I needed a human character and make 3 characters that I could use in rotation, so I didn't need to animate a whole cast. So these 3 characters, and some of these costumes weren't used. Originally there was like a prom scene that we cut, but so I didn't need to animate a whole group of characters. Animation was definitely the busiest part of the process. I spent a lot of long days working in After Effects. The main tasks during this part of the process were can be broken down into character animation, which was especially important because of the relatability we wanted from this animation. We really wanted it to resonate. We also did motion graphics, such as animated text, visual effects, and the more abstract representations of crowds that we did, and compositing, so putting together characters and backgrounds and effects into a finished scene. And I did have a few examples of some of these steps, and they are GIFs, so I'm not sure if they're going to work. This is the shot list I put together to keep track of everything that needed to be animated. This also let me coordinate it with my other coworker who was animating some of the more motion graphics scenes. Oh, good, great. So speaking of limiting the number of characters, I made a walk cycle for each character, and because they all start and end on an identical frame, they are loopable and can be played to fill a lot of animation time very easily if needed. All of these are done on Procreate for iPad. And then here are some of the smaller, more miscellaneous animations that I made, also done in Procreate. So scene-specific ones. And then this is a sneak peek into my personal animation process in Procreate. Because Procreate lets you take, it automatically takes like a video of the process as you're working. So this is just me doing the frames for the walk cycle for one of the characters. Here's an example of compositing one of our scenes. This is just all the layers that went into this particular scene. And this is the protest scene I mentioned earlier. And you can see how like just having the walk cycle play over and over is, you know, that can fill 3 seconds, that can fill 20 seconds. It's a really great thing to have. And now we're gonna watch the animation. It's about a little less than 4 minutes. So please let me know in the comments if you have any issues viewing this or hearing it.
To slow the spread of COVID-19, many people are practicing social distancing, limiting contact with people outside one's household by keeping at least 6 feet of distance from others, and not gathering in groups or crowded spaces. For most people, the best way to maintain this distance is staying home from school and work. But social distancing is not always easy for a variety of reasons. The emphasis on distancing is important because of how COVID-19 spreads. The virus spreads mostly from person to person through coughing, sneezing, or breathing at close range. People can be infected and contagious for up to 2 weeks before showing symptoms, or may be contagious without ever showing any symptoms. COVID-19 is most dangerous to people over 65, anyone with underlying medical conditions, or anyone with a weakened immune system. But young, healthy people can still get very sick, and in rare cases, even die. Young and healthy people are also more likely to not show symptoms even if they do get the infection. This means that you can transmit the virus to others even if you don't have a cough or fever. Even if you aren't at high risk for getting seriously ill from COVID-19, one of your loved ones could be. Social distancing is your chance to protect them and help slow down the disease. Okay, so how do we do that? Staying at home is the safest way to avoid disease transmission. But if you do go out in public, wear a mask that covers your mouth and nose. The mask will lower your risk of spreading the disease to others if you're infected, even if you don't have symptoms. Avoid touching your face, even through the mask, until you're able to wash your hands. Wash your hands often with soap and water for at least 20 seconds, especially after being in public. Make sure to disinfect high-use surfaces too, such as cell phones and countertops. It's important to check in on your own emotional well-being too. It's normal to feel scared or unfocused right now. Doing small things to take care of yourself will have a big impact. Be kind to yourself. Give yourself time to relax, do something you love, and take a break from news and social media. Call, video chat, or otherwise check in with your friends and loved ones. Honor the other things that are important to you as well. If you attend meaningful gatherings, take steps to be safe by wearing a mask and practicing social distancing as much as you can. We're all in this together, and we're doing everything we can to protect ourselves and our communities. First of all, I just want to say, hi, Nancy. Excited you're watching.
So how we shared the animation with the public was really important to us because, as mentioned previously, the main population we wanted to address does not necessarily trust mainstream media. We chose to do the bulk of our outreach on social media to reach a younger population, and we also made a bunch of images and video clips to share, just like easily digestible on Instagram or Twitter. So here are a few of them. This is a GIF that we pulled from the animation. This is one of my favorite scenes with the little door transformation. Hand washing. So we don't have a lot of public reception data to share yet. This really is a brand new project that we just put out a few weeks ago, and our comms team does have plans to promote it further with back to school media. So hopefully there'll be more to share on that later. And this, I think, is one of the most important pieces for me because this was very interesting, taking on a thing, as Jenny mentioned, is that is being updated daily, and creating images that are going to last on an issue that is still being changed and updated, and that we're gaining understanding on. So you can't predict what will happen in an evolving situation. So you have roughly two choices when it comes to communicating about a topic like COVID-19. There's quick and timely, which is what a lot of government health officials will do, trying to get things out quickly to transmit important information to the public. The downside of this kind is that it can become outdated as information changes, but it's really useful for policy changes, testing locations, public health updates and all that. And then what we did was more of a general information overview, where we tried to be as general as possible so that it would hopefully be able to stand up over the next months, year, however long this is needed. It's not useful for time-sensitive information that might be crucial for a public health response, but it is very, just very useful overall. I also learned to build in time for collaboration, especially working. My office right now is completely remote, so I'm just communicating with my coworkers via email and Slack. And the more people you're working with, the more time you're going to need to factor in for delays, especially for remote collaboration. I think I mentioned this when we talked about the script and having a bunch of people review the script at once. And this way you're not getting angry at other people for not responding to your email an hour sooner. Just make sure to leave time for that. It's very important. The pre-production phase for me was vital because we ended up spending a lot of time finalizing the script. We had a lot of time to work on pre-production stuff before the animation started. And because the animation timeline was so hectic, it was really helpful that we decided some of these things beforehand. So, yeah. I guess I can moderate some questions now. Are there questions?
Thank you, Quinn. I'll pull Sarah up to run the Q&A, but that was really fantastic. Thank you so much.
Thank you.
Here she comes. In the meantime, I can see somebody asked whether there are plans to make more of these types of animations.
Yeah, I think I'm actually going to address, if you don't mind, the Procreate question, because I've been seeing it pop up a lot in the comments as well. I'm like one of the biggest advocates in the world for Procreate, which is a digital illustration program specific to the iPad. I use an iPad Pro. And this is like taken over my workflow, basically. Like I almost never use Photoshop anymore because I find Procreate so intuitive. I think it gives me a lot more of a natural feel illustrating, like a more hand-drawn feel than Photoshop. So yeah, I really like working with Procreate, and I am very happy to answer any and all questions that you guys have about it because it is my favorite thing in the world.
Okay, thank you. Sarah's on screen now, so I'll let you take over, Sarah.
Yes, Quinn, thank you. Sorry about that. I took an ill-timed break. So, we got a couple questions, and actually more than a couple, and I think we're doing okay on time, so let's go ahead. The first question is, what was your sole project, or was this your sole project this spring? And how many hours of work do you think the team put in?
Yeah, so I actually proposed this project because I was working from home and I was having trouble concentrating on anything other than the news, and had kind of a light workload. So I was like, oh, well, if I can't concentrate on anything other than this, maybe I should make this part of my work. And a coworker of mine came up with the idea for like the youth focus. We were trying to think of an angle that would work well for us as an organization. And so, yeah, I don't know that we have plans to do more like this. We've done other projects similar to this, and we'll probably do more in the future. We've done some informational videos about HIV that have gone very well. And yeah, so we will produce projects like this from time to time. My organization, the stuff that I do for my organization is mostly games and apps, so interactive elements, but we do a lot of these videos. I appreciate the comment I saw in the questions about it being streamlined, because this really was, I was really just like making it up as I went along. I honestly can't say how many hours though. Like, I was.
Give us a start. Like, when in the year did you start? And
yeah. So we spent most of like April and May on the script, and I was doing the pre-production stuff. Animation was pretty much all of June, and that was mostly me. My co-animator set up a lot of the overhead scenes, and then I would go in and edit them a lot and make them fit seamlessly into the stuff that I had done. So I was, I work a typical like 8-hour, 5 days a week schedule. I was often starting around noon and then breaking for dinner and then coming back and working till like midnight.
Wow.
In After Effects. So
it's
a lot of work. Animation is so time intensive.
Yeah.
But it was a lot of fun.
So this is a good question. In addition to character design, what were some aha moments when creating media for youth in different socioeconomic groups? You know, what different culture or wording or settings did you have some aha moments about how to connect well on those?
That's a great question. I think a lot of the insights that I have about not necessarily working with youth as much as working with Black populations, because we did have feedback from our Youth Advisory Council, but they didn't have a lot to say on this, unfortunately. So mostly I'm working with my coworkers who are not, teenagers, but they are Black, and they did grow up as Black teenagers. And so I'm when I first started here at Game Changer 5 years ago, we started with a birth control app, and I was drawing like hands putting on a condom, sort of typical instructional things. And my boss saw something I was working on. She's like, "Why is that hand white?" And I was like, "Oh, literally had not thought of that." And that was some of the stuff that I unlearned very quickly early on. I also learned a lot about Black hair. I did some character designs where they're like, no one would leave the house looking like that. So I found it incredibly crucial to have Black people on the design team when doing representations of Black people. Like, I would have considered myself a person with life experience before starting here, and it really was just some very, very blatant things that I had to unlearn or just be informed about very quickly that have helped me in the past 5 years. So
so looking back in retrospect, that we do look through we look at white culture as the norm without even considering it. So, and I understand from talking to you in the past that you do have a very diverse workplace. So I think it's healthy that you're not speaking for other people. That they're in the room speaking from their own life experience. Yeah.
Yeah, I
Okay.
do try as much as I can not to do that. And also, I just want to say again about like the white hand. This is something I've noticed because before that I was working in medical illustration, and it was just white was the default, and literally never thought about it before the first day of my new job, where they're like, "Why is that white?" So it's just really interesting to think about integrating that into, you know, not just this sort of outreach to vulnerable populations or to Black and brown populations, but just the way that we keep doing human representations in scientific and medical illustration.
Yeah.
To be aware of that.
All right. Thank you.
Yeah.
So yeah, I think it looks as if you have somebody asked the question. I think you sort of answered it, but we'll just real briefly. They're asking, what feedback did you get from the Black youth, the 15 through 24 age group?
Yeah, I think that was, so I've talked about this. Our youth advisory council has their own project, and then they will come in and consult on some of our projects just as like a youth voice or youth voices for us. So I only showed up in the sessions where they were commenting on my animation, and they didn't know me at all, and they gave me very little like yes and no answers to questions that I we're hoping would become discussions. And so I've talked since about, you know, maybe letting them get to know some more of the staff members so that they felt more comfortable, you know, engaging in a conversation with me. I think what we got was very thoughtful and helpful. I remember specifically that they liked the healthcare tips, and that one of them suggested expanding on the taking a break from social media tip. So they specifically liked that we included that, but other than that, there wasn't a whole lot of specific things we got from them. And I think that's mostly because they didn't know me at all and didn't really feel comfortable, you know, critiquing something I had shown them. So, yeah.
Sure. So I wonder a couple things. I wonder if the conversation were actually led by somebody on your team who is Black, so that they're talking directly to, you know, that they aren't. That could be a barrier. And I only say that because I understand it from friends of mine who are Black and work with youth and you know, show up so that they don't have to have a conversation with a white person, to be blunt about it. But I also wonder, you're an adult to them, and I think, right?
Yeah.
So I'm wondering if the conversation would also go differently if it were peer-led, and then you kind of came in after they'd gathered the feedback. I'm just curious. Well,
I think that's something to discuss for our next class of the Youth Advisory Council, and we've been talking a lot about how we want to use them and how, you know, not only use them, but like making an experience worthwhile for them. So I think that's something we're addressing for later as well.
Well, thank you for your awareness and your openness to learning those lessons. And so that's great. Well, thank you so much. I think the other questions do have to do with Procreate, and so I'll let you wax eloquent, or it's for you to do. It isn't like I let you in the ask a question. And Cappy, do you want to jump on and kind of lead us into or guide us into the next step?
Sure thing.
All right.
Maybe the best way for folks to, here, I'll pop on my video here. Maybe the best way for folks to engage Quinn about Procreate is either in this chat now we have a little break, or we have a big break, or in the question area, if you have specific questions about Procreate that Quinn can answer, those will be connected to this video stream afterwards, and will be accessible, like I said, for the rest of the month.
And I have a question, which is,
sure.
this might already be on the program. I'm not sure, but I saw someone ask about the link to the video itself, and I'm not sure where the best place is to share that, because that is publicly available, and I would love to give people access to that.
Absolutely. I think I saw it streamed by in the chat, but if you don't mind posting it in the chat here, that would be fantastic. Then the chat also stays visible and people can scroll through. So if you post it close to the end.
Yeah. I might also, if it's okay, post it in the GNSI Facebook page.
Of course. Jen may have already done so.
I think, yeah, I just thought, oh, thanks, Jenny.
Yeah, she's great. Cool. So I will just wrap up here. Thank you so much, Quinn. That was so fascinating. And I love the juxtaposition between Jennifer Fairman's, which was very technical and targeted to an audience with great facility in this realm, versus yours, which was for a very general audience and trying to just get very basic information out there. So it was a really neat juxtaposition.